Hello, this is Dr. Marty Klein with another video quickie. Today I want to talk about what so many therapists get wrong about sex. Psychotherapy has developed a wonderful set of tools. Every year, skillful therapists save marriages, facilitate divorces, educate parents, ease trauma, and help people overcome depression or anxiety, sometimes linking patients up with psychiatrists. But one of American psychotherapy's main weaknesses is the area of sexuality. Most therapists get almost no training in human sexuality, often as little as 10 hours, typically focusing on child molestation and sexual violence and sexual orientation and gender identity. What's missing? Such mundane issues as the sexual side effects of common medications, contraception, why many women don't orgasm with a partner, how Viagra works, just how common masturbation is, and the truly ambiguous nature of sexual exploration, hooking up, seduction, desire, and teasing. The world may be focused on me too, but in real life, no doesn't always mean no, just like yes doesn't always mean yes. Well, without specific training in day-to-day sexuality, most therapists have to fall back on their personal experience and cultural norms. The former is always limited and frequently negative, while the latter is typically shame-centered and naturally slanted. Here are some of the ways that psychotherapy could do better about sexuality. 1. Porn addiction and sex addiction. These dangerous concepts are considered mainstream by therapists who don't know much about sex. Clients who use a lot of porn, almost always men, or go to sex workers, ditto, are often considered addicts who need to be in lifelong recovery. Most therapists don't have a model of using porn or visiting sex workers that imagines a guy making a rational choice or loving his partner. And when a woman busts a guy for watching porn, most therapists don't talk about why she finds his porn watching so upsetting, or the fact that they didn't have a no porn agreement when they coupled up. No, the question is typically, how do we get the guy to stop this disgusting habit? 2. Infidelity. The typical therapist sees infidelity as involving a selfish betrayer and a victimized betrayed. There's rarely much discussion of the betrayed's contribution to the messy relationship, especially if it's a woman who has gradually withdrawn from her mate sexually. Unfortunately, most therapists handle infidelity by supporting radical power imbalances from unlimited, yes, unlimited discussions of how could you do this to me, to giving control of the betrayer's phone and laptop to the betrayed. This kind of control does not build trust. It never satisfies the betrayed, and it only creates distance between the couple. Worst of all is the new fad of formal therapeutic disclosure. This is where the betrayer, often identified as a sex addict if it's male, is required to tell his partner every feature of his unauthorized sexual behavior. How many times, how many minutes, how many orgasms, which positions, what color lingerie, etc. The process is labeled as promoting healing, but it simply gives the betrayed a jillion details to obsess about, preventing real peace or reconciliation. I sometimes wonder if its main purpose is to provide titillation to repressed voyeuristic therapists. Well, number 3, the meaning of sexual fantasies. Almost everyone has fantasies that they don't act out. Leaving your family and starting a new life in Paris, embezzling money and paying off your house, finally telling off that bossy sister-in-law, and eating all the chocolate in the entire world, to just name a few. Most people know that these fantasies are not dangerous and that they have no predictive value. Most people don't avoid driving past a bank because they occasionally fantasize about robbing a bank. Unfortunately, many people lose that common understanding when the fantasy is sexual, and too many therapists do too. So patients racked with guilt or fear about their fantasies, does that mean I'm gay? Does this mean I'm a child molester? Am I doomed to be unfaithful? Don't get the friendly reassurance from therapists that they need. Instead, some therapists want to decipher what a sexual fantasy means, or they try to change it to something more normal. Repeat after me. Unless it's totally obsessive, sexual fantasies have no meaning. No, you don't really want to have sex with Lassie. If your therapist tries to make your sexual fantasy more normal or more ethical or less patriarchal, run in the opposite direction. Next, sexual orientation. Today's therapists are making sexual orientation so complicated, it's now the tail wagging the dog. Asexual, demisexual, gray sexual, the definitions of the now dozens of orientations are virtually indistinguishable from what used to be called preference, ambivalence, and even, I'm not sure. We don't need a special word for people who lack interest in sex, or are turned on only when they feel emotional connection, or like a bit of risk taking with their sex. These are just common configurations of the wide range of human sexualities. Why does it matter? As a therapist, I know that categories typically end conversations. When I ask, how did you decide to do X? And the answer is, I'm conflict avoidant, or QPO romantic, or whatever. Patients are actually avoiding investigating how they feel, what they want, and what they were trying to accomplish. Therapists strive to be understanding and accepting. That's terrific. As long as we keep encouraging people to explore themselves rather than accepting shortcuts that require little thought and mean very little. A discussion of what tribe someone belongs to is not the same as a discussion of who they actually are. A conversation about sex that lacks this personal element is sad and incomplete. I'm Dr. Marty Klein. Thanks for joining me. Oh, by the way, I publish a video quickie every couple of weeks, so if you want to get pinged the next time I do, click the subscribe button at the bottom of your screen, and you'll find out the second I do. Thanks a lot for joining me.